Today we are going to see analgesic antipyretic drugs from GPAT point of view and other exam point of view. So let's start the topic. We have already completed our drug acting on CNS from pharmacology. In that we have seen introduction to nervous system. After that we have also seen the general anesthetic chapter, then anticonvulsant drugs, sedative hypnotic drugs, anxiolytic drugs, drug used in the Parkinsonism. We have already seen the narcotic analgesics. So the remaining portion is nothing but your today we are going to see that remaining portion, that is nothing but the non-steroidal anti-inflammatory drugs and antipyretic drugs. Commonly you used to call them. See what is important from first of all you should know what do you mean by analgesics and antipyretics. So what are the analgesics? Analgesics are nothing but these are the drugs which will reduce your pain, which will decrease your pain. Okay, so there are different ways to reduce your pain. There are different targets that drug can interact with the different receptor to decrease your pain sensation. And what are those targets? First target will be your opioid receptors. So those drugs which can interact with the opioid receptor and will reduce your pain, causing drowsiness. These are known as opioid analgesics. Those drugs which will not interact with the opioid receptor. Those drugs which will not interact with the opioid receptor and will reduce your pain, and they don't have any steroidal structure. So they are known as a non-steroidal anti-inflammatory drugs, and they can be either they if they have a steroid nucleus, they are known as a steroidal anti-inflammatory drugs. So these kind of drugs are there are of three types. Those so analgesic drugs, they will decrease your pain. Okay, they will reduce your pain. So there are three kind of analgesic drugs. First one is known as central analgesics or opioid analgesics. Those which will interact with your opioid receptor and they will decrease your pain. But they will cause sedation, they will cause drowsiness, they will cause euphoria. So those are known as a central analgesics. So there is another different chapter known as a central analgesics. Another category of drug that are used to decrease the inflammation and pain, and they are having steroid nucleus in the structure. They are known as a steroidal anti-inflammatory drugs. And another category is there, those are not having those drug which will not interact with the opioid receptor, those drug which will not interact with the opioid receptor, those drug which will not have steroidal moiety in the structure, those are known as a non-steroidal anti-inflammatory drugs. And in this chapter, in this session, we are going to see those drug only. So let's start the topic now. I will not admit. I have told you there are three kind of analytics. So analytics, central analytics, then steroidal analytics, and non-steroidal analgesic anti-inflammatory drugs. Okay, so they relieve your pain without interacting with the opioid receptor. I'm talking about the non-steroidal, and then they reduce the elevated body temperature. Elevated means increased body temperature. So they have antipyretic effect. Antipyretic means they will decrease your body temperature up to normal, not less than normal. Okay, these are the drugs. Analgesic antipyretics are the drugs that will reduce your pain without interacting with the opioid receptor. They will decrease your body temperature. That is having antipyretic effect. Okay, possess they will have anti-inflammatory properties. Therefore, they are also known as a non-steroidal anti-inflammatory drug because they will not have any steroid ring in their structure. Okay, that's why non-steroidal anti-inflammatory drugs. These drugs will have these properties. We are going to take this chapter in a short way so that it will be better for your GPAT. And these most of the analgesic antipyretic, okay, most of the NSAID, not all, but there are few drugs which have anti-platelet actions. That means they prevent the platelet aggregation. Okay, means they are also useful in the as an anticoagulant. They do not cause sedation and sleep, as well as they do not cause any kind of addiction. So these are the properties of your analgesic antibiotic. So these NSAIDs properly, they will not cause any kind of sedation. They will not induce sleep. They are not liable for addiction. So those central analgesics like your morphine, codeine, then methadone, pethidine, etc. All the central analgesic, those which will interact with the opioid receptor, they are also known as the opioid analgesic, and they cause sedation, they cause drowsiness, they cause euphoria, and that's why they are liable for addiction. But these drugs will not liable for addiction. How temperature is regulated in your body? Temperature is regulated in the body. How? देर आर हाउ देर इज रेगुलेशन ऑफ टेम्परेचर इन बॉडी. वो आपका टेम्परेचर बॉडी का बढ़ता है कम होता है, इसका रेगुलेशन कहाँ पर होता है. सो द कोर बॉडी टेम्परेचर इज measured by different way. You can measure your body temperature in a different way. You can you can use thermometer in your mouth. You can use thermometer underarm, in the underarm, and you can use thermometer. You can insert a thermometer in the rectum. Out of these three, most accurate temperature measurement is nothing but the rectal temperature. So whatever temperature measured in the inserting the measured by inserting the thermometer in the rectum, that is the most accurate temperature. Normally, what is your normal body temperature? 31.1, sorry, 36.1 to 37.8 degrees Celsius. So it is your normal body temperature, 31.1, 37.8 degrees Celsius. So if there is a decrease in the temperature than this normal temperature, again it is a pathological condition. If there is an increase in temperature from this range, so again that is known as a pyrexia or a hyperpyrexia. So that means fever. Pyrexia, core temperature more than normal. That is a core temperature. If your body core temperature is 41 degrees Celsius, so that it is known as a hyperpyrexia. That means you have increased the body temperature, and it may result in the fatality. It may result in the it may result in different complications like convulsions, coma, and death. So increase the body temperature up to 41 degrees Celsius. That is dangerous, known as a hyperpyrexia. Now, body temperature is controlled by two mechanisms. Normally, your body temperature is controlled by two mechanisms. What are these two mechanisms? First, cutaneous vasodilation and increase in the sweat gland activity. So, if your body temperature is increased, so your body has a different kind of receptors like chemoreceptors. Those will send a message to a hypothalamus. There is one center in the hypothalamus known as a temperature regulating center, and whatever may be the response, either the temperature is decreased or increased, so that signal will be sent to your hypothalamus. Now hypothalamus, your temperature is increased and that signal is received by hypothalamus, then hypothalamus will send message via chemical messengers or neurotransmitters. So it will cause cutaneous vasodilation. Whatever the blood vessels are there in the cutaneous layer, जो आपके पेरिफेरल जो ऑर्गन्स होते हैं, जैसे आपका आपके लिम्स हो गए, आपका हैंड्स हो गया, या पेरीफेरी जो है, so whatever the peripheral blood vessels are there, they will be dilated. That means there will be more heat exchange with the environment. So whatever your body temperature is increased, so that will be exchanged with the environment. So there is a heat loss due to cutaneous vasodilation. Again, due to increased activity of your sweat gland, so your sweat gland will produce more sweat, ज़्यादा पसीना आएगा आपको, ठीक है, and that sweat is in your body, that is evaporated due to that heat. So that increased body temperature is utilized for evaporation of sweat, and that's how your body will be cooled down. So that is one mechanism. And again, if that is a peripheral mechanism, and central mechanism is nothing but the temperature regulating center. So that will be directly set either positive or either negative. फॉर एग्जाम्पल इन केस ऑफ पायरेक्सिया व्हाट हैपेंस, अगर आपको फीवर आता है तो उसका मतलब ये है कि आपका जो सेंट्रल टेम्परेचर रेगुलेटिंग सेंटर है उसका पॉजिटिव साइड पे शिफ्ट हो चुका है. सो व्हाट एवर टेम्परेचर रेगुलेटिंग सेंटर इज देयर, सो दैट इज शिफ्टेड टू पॉजिटिव, and that's why you are getting a fever. Now what is the aim? Your aim should be shift that temperature regulating center towards the negative side, so that your body temperature will be normal, and that is done by few drugs, those which can shift the temperature regulating center to a normal. And there are two mechanisms, that is first one is central and second one is a cutaneous. Okay, that second one is a peripheral. So because of peripheral cutaneous vasodilation, your heat will be lost, and due to increased activity of your sweat gland, again heat will be lost. That is one. In case your body temperature is less than normal, then what happen? Again, the signal will be sent to your thermostatic regulatory mechanism in the hypothalamus, and then hypothalamus again will either uh, increase either increase the cutaneous vasoconstriction. In that case, cutaneous vasoconstriction will be there. Cutaneous के जितने भी blood vessels वो क्या होंगे, constrict होंगे. Now that because of the vasoconstriction, your heat loss is prevented. Now you will retain the heat. So that's why that heat is utilized to raise the body temperature. And again, there will be decrease in the sweat gland activity. So in case of body temperature is less, ये cutaneous vasoconstriction होगा, एड्रेनलिन का एक्टिविटी कम होगा। अगर टेम्परेचर बॉडी का ज़्यादा हो चुका है तो आपका क्यूटेनियस वैसोडाइलेशन होगा, आपका जो स्वेट ग्लैंड है उसका एक्टिविटी बढ़ जाएगा ताकि आपका बॉडी टेम्परेचर कम हो सके। दिस इज द मैकेनिज्म दैट इज इन्वॉल्व इन द मेंटेनेंस ऑफ योर बॉडी टेम्परेचर। We'll see now the next points. What are the pyrogens? What are the pyrogens? So these are the bacterial lipopolysaccharide. So these are the metabolic product of your bacteria that has a capacity to increase your body temperature. That's why they are known as pyrogens. Pyro means pyrexia. Gens means agent. So those are the agent which will increase your body temperature. They are known as pyrogens. Okay. Particularly pyrogens are nothing but the metabolic product of your bacteria. So they are chemically they are lipopolysaccharide in the nature. So mostly वो lipopolysaccharide and they can increase your body temperature. So that's why they are known as the pyrogens. Pyro means pyrexia and gens means causative agent. So those are the pyrogens. It is a bacterial lipopolysaccharide. They can activate the macronuclear phagocytic cell of your body to release the chemicals. First one is the interleukin and second one is the tumor necrosis factor. Now these two chemicals they are released because of the pyrogens. Okay. Now these two factors will have action on endothelial layer of your blood vessel. So they act on the vascular endothelium and stimulate local synthesis of prostaglandin, particularly prostaglandin E. And this is prostaglandin is responsible for the pain, inflammation and increased body temperature. क्या होता है कि पायरोजन जैसे आपकी बॉडी में बैक्टीरियल वगैरह पायरोजन आता है तो वो क्या करेंगे आपके जो बॉडी का डिफेंस मैकेनिज्म होता है जैसे आपका phagocytic cells वगैरह so phagocytic cells then enterochromatin cells they release the chemicals like interleukin 1 and tumor necrosis factor. Now these two chemical act on the endothelium of your blood vessel to produce prostaglandin, which are the responsible for the pain and inflammation as well as your pyrexia, which causes fever and anorexia. Now, what is your aim? To decrease the production of prostaglandin. So for that, we should know how PGs are synthesized endogenously. आपके बॉडी में prostaglandin synthesis कैसे होता है ये आपको मालूम होना चाहिए. So that you can block the different steps. Okay. So we are going to see that in the next slide. What is inflammation? Inflammation is nothing but the inflammation is a reaction in the living tissue to the injury. So whenever there is injury to your tissue or cell, so what happens? The in opposition of that injury, your body will produce some chemicals, and these chemicals will show some platelet aggregation. Then there will be swelling, there will be redness, etc. Cutaneous vasodilation. So those reactions is nothing but the inflammation. So inflammation is nothing but the reaction in living tissue to the in the response of injury. There are three aspects of inflammation that is used for measurement. They are first erythema. Erythema means local vasodilation. So there is a local redness on the skin due to erythema. Then edema. Edema means increased vascular permeability. So blood vessel का permeability बढ़ जाएगा. आपका blood के अंदर जो fluid है that will be leaked outside the blood vessel in the interstitial fluid. इडिमा. सो अगर ब्लड वेसल के अंदर का जो लिपिड मतलब वो अगर आपके इंटरस्टिशियल स्पेस में आ गया तो आपका क्या होगा सूजन आएगी आपको. दैट इज नथिंग बट द इडिमा एंड फॉर्मेशन. दिस इज नथिंग बट द इन्फ्लेमेशन. ओके. सो इन्फ्लेमेशन इज देयर. mechanism of action of NSAIDs. Mechanism of action of non-steroidal anti-inflammatory drug. So what is the mechanism involved, and after that we will see how prostaglandins are produced in the body. So first we'll see mechanism of action for NSAIDs. Now what happens during the inflammation, pain and fever? So whenever there is an injury to your tissues, your tissue is having lipid bilayer. Okay, that is known as the plasma biological membrane. During the if there is any kind of injury to your cells, so that plasma membrane get damaged. Plasma membrane gets broken down. Damaged plasma membrane will release one chemical known as a damaged. You know that plasma membrane is nothing but it is made up of phospholipids. Okay, so whenever there is an injury to your tissue, so plasma membrane will be broken down, and as it is made up of phospholipids, so phospholipids will be released. Phospholipids will be converted into arachidonic acid. It is nothing but the semi-essential fatty acid. You know that you might have read in the biochemistry, semi-essential fatty acid. So 20 carbon atom arachidonic acid. Okay. Now that arachidonic acid is sequentially converted into different chemicals like prostaglandins, thromboxane, leukotrienes, etc. etc. Those chemicals are nothing but they are responsible for the pain, inflammation, then pyrexia, then bronchoconstriction, etc. etc. This arachidonic acid is converted into prostaglandin by the enzyme known as a cyclooxygenase to the prostaglandin. Now these prostaglandins they will sensitize the blood vessel to affect other inflammatory mediators that can increase the permeability of blood vessels. Now these prostaglandins synthesize these prostaglandins whatever is synthesized from this arachidonic acid themselves they are a pain mediator. They are the chemical responsible for the pain. They also increase the sensitivity of your blood vessels to other mediators. They will cause more inflammation. Now you have different enzymes, three kind of enzymes that are involved in the conversion of arachidonic acid into prostaglandin. So first one is known as a COX-1, cyclooxygenase 1. Okay, first one is known as a COX-1. Now the COX-1 is present in the nearly all kind of cells and tissues. Okay, and it is a constitutive enzyme. This enzyme is involved in the tissue homeostasis. So if there is damage to tissue, the repair is done by this COX-1. And remember, this has a housekeeping function. COX-1 is a housekeeping function. COX-2 is a again enzyme. Activity is normally absent in the cells. Normally ये COX-2 जो होता है that is absent in the cells except from the kidney and brain. So it is present in the kidney and brain, but it is absent in the outside okay, normally. But it can be induced by bacterial lipopolysaccharides. That means it can be induced by pyrogens, okay, and interleukin 2 and tumor necrosis factor. So these two chemicals and lipopolysaccharide will induce COX-2, and COX-2 is that is the so COX-2 jo that is responsible for the inflammation. This COX-2 it is having induction. So it can be induced by either lipopolysaccharide, that is a pyrogen, can be induced by tumor necrosis factor. And remember over here, this COX-1 is known as a COX-1 is nothing but the constitutive enzyme and has a housekeeping function. And COX-2 is nothing but the it is inducible by pyrogens and interleukin and tumor necrosis. So inhibition of COX-2 will give you better anti-inflammatory activity. Remember, inhibition of COX-2 will give you better anti-inflammatory activity than COX-1. COX-3 is also there. Its activity is normally seen in the brain, responsible for the temperature regulation. So remember these points. I will highlight them again. Remember, COX-1 is nothing but the constitutive enzyme, and it is COX-1 is constitutive enzyme. It is present in all kind of cells. It is involved in the tissue homeostasis. If there is a damage to your tissue, so this enzyme is involved in the repairing. That's why it is having housekeeping function. इसके ऊपर question आ चुका है housekeeping function. COX-2 is nothing but it is inducible. It is normally absent from the cells. It is only present in the brain and kidney, but it is inducible. It can be induced in other cells and tissue by pyrogens and these two chemicals known as the necrotic factors and interleukin. Okay, so it is inducible by these two and is responsible for the inflammation. Inhibition of this COX-2 decrease the inhibition. Inhibition of COX, that means non-specific inhibition of COX will also helpful as a anti-inflammatory agent. But inhibition of this COX-2 preferentially or particularly selectively is more useful as an anti-inflammatory. COX-3 is also enzyme. It is normally absent in the other tissue. Activity of COX-3 is responsible for the temperature regulation in the brain. That's why paracetamol, you might have seen the paracetamol. So paracetamol is an antipyretic drug, okay, that acts by inhibition of COX-3 enzyme. COX-3 activity is inhibited by paracetamol. Remember, it is a selective COX-3 inhibitor in the brain. That is also responsible for its antipyretic effect. That's why आपका body temperature कम कर देगा paracetamol interacting with the COX-3 receptor. Now I would like to explain here what is the mechanism how there is a development of pain and inflammation. So first of all, you see your tissue is made up of a membrane known as a biological membrane. Tissue is covered by a biological membrane, and whenever there is injury to your tissue, okay, whenever there is injury to tissue, so your biological membrane that is gets ruptured, is get damaged. Okay, so if your biological membrane get damaged, and you know that this is made up of your phospholipids. Phospholipids will be released. Now these phospholipids are converted by this phospholipase A2. Lipids are converted by one enzyme phospholipase A2 into arachidonic acid. Arachidonic acid आपका मेम्ब्रेन डैमेज होने के बाद फॉस्फोलिपिड जो आते हैं वो फॉस्फोलिपिड से क्या बनता है एराचिडोनिक एसिड फॉस्फोलाइपेज A2 एंजाइम. So this arachidonic acid is a 20 carbon atom containing acid. 20 carbon atom containing fatty acid. You might have seen the biochemistry. It is a semi-essential fatty acid. This arachidonic acid is taken up by two enzymes. One is known as a COX. That is cyclooxygenase. Now arachidonic acid is taken up by COX and it is converted into different prostaglandins. Prostaglandins बनाए गए से. Nothing but the prostaglandin D2, prostaglandin E2 and prostaglandin G alpha. Then prostaglandin I2. Okay, then prostaglandin I2 and thromboxane. So these are the chemicals responsible for the pain, inflammation and pyrexia. Okay, pain, inflammation and increase in the body temperature. They will cause pain, inflammation and increase in the body temperature. So that's why. Okay. Now arachidonic acid also has another fate, another enzyme convert arachidonic acid into leukotrienes. Okay, known as this 5-lipoxygenase. Okay, so 5-lipoxygenase is the enzyme that also convert arachidonic acid into leukotrienes. So whatever leukotrienes are there, there are different type of leukotrienes. LTB4, that is a chemostatic. It is a protective function. Now these leukotrienes, okay, so leukotrienes जो बनाएगा वो, तो जो leukotrienes है, that is are responsible for the bronchoconstriction. Whatever leukotrienes are there, so leukotriene C4, leukotriene 4, leukotriene E4. So these leukotrienes are responsible for the they will act on their receptor. Leukotriene receptors are there. They will act on their receptor and they will cause bronchoconstriction. And that's why this. Okay. Now blocking of this COX-1 will get anti-inflammatory action. Blocking of this COX-1, you will get anti-inflammatory action. So first we will see this phospholipase A2 blockers. So whatever steroidal anti-inflammatory drugs are there, like dexamethasone, betamethasone, triamcinolone, then your prednisolone, all these kind of steroidal anti-inflammatory drugs, they will block the synthesis of arachidonic acid from the phospholipid by inhibiting this enzyme phospholipase A2. Okay, then this NSAIDs, non-steroidal anti-inflammatory drug, inhibit the COX is cyclooxygenase and prevent the formation of prostaglandins and thromboxane A2, and that's how they will act as an analgesic and antipyretic. There is another category of drug. They are known as a phospholipase. They are known as a lipoxygenase inhibitor. So Xylitol is a lipoxygenase inhibitor. So that's why these kind of drug they are useful in the asthma kind of drug. Then again leukotriene blockers are also there. Leukotriene blockers are also useful in the asthma. So this right hand side arachidonic acid, they are helpful in the asthma. Blocking of your left hand side of your arachidonic acid, it is helpful in the pain and inflammation. Okay, and that oral drug will block synthesis of arachidonic acid from the phospholipid bilayer of your phospholipid fraction of your cell membrane. तो यहाँ पे याद रखो मेम्ब्रेन को डैमेज होगा, फॉस्फोलिपिड निकलेगी मेम्ब्रेन से, phospholipid will be taken up by this phospholipase A1 and A2 enzyme that is converted into arachidonic acid. Now arachidonic acid is sequentially converted into either prostaglandin and thromboxane A2 and leukotrienes. Arachidonic acid is converted into prostaglandins and thromboxane by COX enzyme, cyclooxygenase, and converted into leukotriene by lipoxygenase. So inhibition of this lipoxygenase is helpful in the asthma because these leukotrienes they have bronchoconstriction action. Okay. Steroidal drug act on this enzyme phospholipase A2. They are inhibitor of phospholipase A2. They will prevent the formation of arachidonic acid. And once arachidonic acid is not formed, so further complications will not be there. So that's why they are also useful in the pain and inflammation. So these steroidal anti-inflammatory drug like dexamethasone, betamethasone, then prednisolone and etc. These are also useful in the pain and inflammation. They will not have a selective action. They will also inhibit the formation of your leukotrienes. Okay, so they will not have selective action. But COX inhibition will give you selective action, that is selective anti-inflammatory action. Okay, selective anti-inflammatory action. inhibition of COX. And inhibition of LOX means lipoxygenase will useful in the this bronchial constriction. Again, this mast cell. So cysteine leukotriene receptors are there. So they are also inhibited by these two drugs, montelukast and zapirlukast. Zapirlukast and montelukast. So these are the different kind of drugs that acts on a synthesis that blocks the synthesis of endogenous mediators of pain, inflammation, and bronchoconstriction. Now we'll see the classification. Now we'll see the classification of non-steroidal anti-inflammatory drugs. So what are the different classes? So this chart is also given in the KD Tripathi book, classification by KD Tripathi book. What are the different classes of analgesic antipyretic drug? They are either classified as a non-selective COX inhibitor. First class is nothing but the non-selective COX inhibitor. Non-selective COX inhibitor means what? They will inhibit COX1 enzyme as well as COX2 or as well as COX3. So they will have no selectivity in the action. They can inhibit all COX enzymes, COX1, COX2, COX3. But in case of pain and inflammation, inhibiting COX2 selectively will give you more benefits. Okay, these are the drugs which are known as non-selective COX inhibitor. So what are these? They are also known as a traditional anti-inflammatory agent. फर्स्ट जनरेशन एंटी इंफ्लेमेटरी एजेंट, ये आपको बहुत सारे बुक में नहीं मिलेगा. फर्स्ट जनरेशन एंटी इंफ्लेमेटरी, ट्रेडिशनल एंटी इंफ्लेमेटरी, बहुत सारे बुक पढ़ के मैं बोल रहा हूँ. ठीक है, में उसमें कितने क्लासेस है? फर्स्ट क्लास विल बी योर सैलिसिलिक एसिड डेरिवेटिव. So in that you have aspirin, methyl salicylate, salicylate, then myrylate, etc. etc. Next class will be your propionic acid derivative. So in that you have propionic acid derivative. In that you have ibuprofen, then ketoprofen, naproxen, flurbiprofen, ketoprofen, naproxen. They all are the propionic acid derivative. Then next class is nothing but the phenamate, or they are also known as the phenamic acid derivative. Phenamate or phenamic acid derivative. In that you have mefenamic acid and phenfluraminic acid. Acid and phenfluraminic acid. So next class is nothing but the enolic acid derivative, or they are also known as oxycams. Next class is nothing but the enolic acid derivatives. They are also known as oxycams. Okay, so in that you have pyroxicam, tenoxicam, meloxicam. Okay. Next class is acetic acid derivative. Next class is acetic acid derivative. Acetic acid derivative में आएगा आपका prolac, then indomethacin and nabomethol. This indomethacin can be characterized as an indole acetic acid derivative. It is an indole acetic acid derivative. Next class is a pyrazolone derivative. So, pyrazolone derivative, in that you have phenylbutazone and oxyphenbutazone. Out of this, oxyphenbutazone is a prodrug of phenylbutazone. This is known as a non-selective COX inhibitors. Now selective COX inhibitors. So this was the first class. Now second class, selective COX2 inhibitors and preferential COX2 inhibitors. Now दूसरा class है आपका preferential COX2 inhibitor. What do you mean by preferential COX2 inhibitor? So these are the drugs which will preferentially inhibit the COX2. So that doesn't mean they will not inhibit the COX1. They also inhibit the COX1, but they inhibit COX2 more than COX1. That's why they are known as preferential COX2 inhibitor. Okay. So in that you have nimesulide, diclofenac, aceclofenac, meloxicam, and etodolac. Remember these drugs: nimesulide, diclofenac, aceclofenac, meloxicam, etodolac. There was a question in GPAT 20. They was mentioned nimesulide, diclofenac, aceclofenac, and they are categorized as this was non-selective COX inhibitor, selective COX2 inhibitor, preferential COX2 inhibitor. So option was preferential COX2 inhibitor. So remember these nimesulide, diclofenac, aceclofenac. These are nothing but the preferential COX2 inhibitor. They will inhibit COX2 more than COX1, but they inhibit both COX1 and COX2. Then now selective COX2 inhibitor. Selective COX2 inhibitor. They only inhibit the two enzyme, cyclooxygenase 2 enzyme. So these are the nothing but the celecoxib, then itrocoxib and paracoxib. Okay. So all the coxibs. So you can see the suffix coxib. All these coxibs are the derivative of these are nothing but the selective COX2 inhibitor. They are very good analgesic anti-inflammatory drug. Discuss it in our upcoming slides. This was the second, third, and now fourth class is nothing but the analgesic antibiotic with poor anti-inflammatory action. These are also analgesic antibiotic drug, poor anti-inflammatory action. मतलब ये ड्रग एनालिसिक होंगे, एंटीबायोटिक होंगे, लेकिन एंटी इंफ्लेमेटरी एक्टिविटी उनको उतना नहीं है जितना होना चाहिए. दिस इन दैट यू हैव फर्स्ट क्लास पैराअमाइनोफेनॉल डेरिवेटिव. So in that you have paracetamol, which is also known as acetaminophen, then phenacetin. Another drug is there known as a phenacetin. pyrazolone derivative. So in that you have two drugs, pizole and propinazole. Propopinazole. So these are known as a analgesic antipyretic with less anti-inflammatory activity or poor anti-inflammatory activity. Then next in that next you have uh, benzodiazepine derivative. Nipo and Nipopam is the drug. The classification as per KD30. We will see the classification again in a short. Remember the classification. Classification is very important. So again we'll see now classification of analgesic antibiotic drug. You can see over here. First class is nothing but a non-selective COX inhibitor. So first class क्या है आपका non-selective COX inhibitor. Non-selective COX inhibitor. They are also known as non-selective or traditional non-steroidal anti-inflammatory because they will inhibit both COX-1 as well as COX-2. Known as a traditional anti-inflammatory drugs. They will inhibit the COX-1 and COX-2. So in that you have different subclasses, salicylic acid and their derivative like salicylic acid, methyl salicylate, sodium salicylate, and paraminophenol derivative like paracetamol and phenacetin and paracetamol. Then the next class is nothing but the pyrazolone derivative. So in that you have phenylbutazone and oxyphenbutazone. Next class is nothing but the indole derivative. You have indomethacin and sulindine. Next class is nothing but the heterocyclic acetic acid derivative. So in that you have daclofenac, tolmetin and ketoproline. The next class is a propanic acid derivative. In that you have ibuprofen, phenoprofen, naproxen, ketoprofen and pipropane. Then next class is known as a phenamate or phenamic acid derivative. In that you have two drugs, mefenamic acid and fluphenamic acid. And next class is known as oxycams. Oxycams. So in that you have pyroxicam, meloxicam, lornoxicam, etc. etc. This was the traditional NSAID. Now preferential COX-2 inhibitor, second class. Class में subtypes होते हैं आपके. Class is known as a preferential COX-2 inhibitor. They will inhibit COX-2 enzyme more than COX-1. So in that you have known slide nabomethone meloxicam. This was question in GPAT 20. Okay. Then again third class will be your selective COX-2 inhibitors. Third class will be selective COX-2 inhibitors. Then you have COXIPs, Celocoxib, Itrocoxib, Paracoxib, and other Raficoxib, Valdecoxib. There are a lot of drugs. So this is the classification of your non-steroidal anti-inflammatory drugs. This is the classification of analgesic antibiotic. So you have to remember this classification in any condition. So there might be at least one, two or three questions from this. There may be maximum three questions from this chapter. Now first we will see the pharmacology of salicylic acid. What are the salicylic acid and their derivative and their pharmacological actions? Pharmacological actions of salicylic acid and derivative. In that you have these drugs. Your salicylic like methyl salicylate, sodium salicylate, known as acetyl salicylic acid. So these drugs, acetyl salicylic acid is known as aspirin. Acetyl salicylic acid is known as aspirin. So methyl salicylate, sodium salicylate, and acetyl salicylate has a different action on your body. So we'll see it. First, local action. So locally, when applied, this acetyl salicylic acid has a counter irritant drug, keratolytic. Keratolytic means that will break down the keratin. So का होगा मराठीमध्ये त्याला मतलब क्रूप येणे आणि ज्याला टाचामध्ये क्रूप होतो means that is a extra layer of keratin on the your heel. To remove that, keratolytic drugs are used. So you might have seen this acetyl salicylic acid patch or bandage that is easily available in the medical shop. Corn cap. The name of that is not nothing but the corn cap. So corn cap consists of your salicylic acid. Okay, that is a keratolytic. Then also locally it is act as an antiseptic and fungicide means it will stop the infection of fungus. So antiseptic and fungicide. Now we'll see the action of acetyl salicylic acid on CNS. Aspirin CNS के ऊपर क्या action देता है? Analgesic, relieve pain. So this remember aspirin is combined with the codeine. Is combined with the codeine for a synergistic effect. So they might ask you one of the following combination is used as a used for synergistic effect. So if codeine and aspirin they are combined, they will act as a synergistically. They will act as a synergistic combination. Remove this. Aspirin irreversibly inhibit the biosynthesis. Aspirin irreversibly inhibit the biosynthesis of your glandis by inactivation of COX or by inhibition of COX. Okay, irreversible because these are the salicylic acid and derivative. They inhibit irreversibly. And other NSAIDs they inhibit COX reversibly. So irreversible कौन है? Salicylic acid. बाकी सब reversible inhibit. Other NSAIDs are reversible inhibitors or they inhibit the reversibly same enzyme. Salicylic acid is a, or aspirin is an irreversible inhibitor of COX. Remember, they are used as a painkiller. They are used to decrease the pain, mainly used for dull, itching, and throbbing pain intensity arising from muscle pain or from muscle or joint. So they are used in the muscle pain or joint pain. Dysmenorrhea and toothache. What is meant by dysmenorrhea? Dysmenorrhea means excessive bleeding from female gonadal organ. Okay, and toothache. Toothache means pain due to tooth. Next one is antipyretic. So that is also analgesic action or antipyretic action. So in case of fever, your thermostatic mechanism is set to higher level. So आपको अगर body temperature ज़्यादा है उसका मतलब है कि आपका thermostatic mechanism जो है आपका syllabus में that has been set to higher level. Okay. Now thermostatic mechanism and reset it to a normal level, and that's how they are helpful to bring your body temperature to a normal. So that is the antipyretic effect of this salicylic acid and their derivative. Salicylic acid and paracetamol they inhibit the prostaglandin synthesis in the brain. They also this action also contribute the antipyretic action of your salicylate. So they inhibit the prostaglandin in the brain. Okay. Then next one is what is the pharmacological action or what is the effect on respiration. So this stimulation of respiration by direct stimulation of medullary center and indirectly increase the oxygen consumption by skeletal muscle. Remember this salicylate they will stimulate the respiration. They might ask you question like that. One of the following is not a pharmacological action of pharmacological action of salicylates, or one of the following is not a pharmacological action of acetylsalicylic acid. So they will give you this action. You have to find the wrong option. You ask you such kind of question. Metabolism के ऊपर क्या? Acid base balance and electrolyte balance. They causes respiratory alkalosis. They causes respiratory alkalosis. What do you mean by respiratory alkalosis? In the carbonate production, uh, uh, the carbon dioxide production, right? Carbonic acid production, carbonate production. That is nothing but the respiratory alkalosis. That is done by this aspirin. Okay, by the therapeutic doses of aspirin. So it will produce respiratory alkalosis. Remember it now. You might have I have already explained these things in the when we were discussing the general pharmacology. So if you want to remove a acidic drug from your body, you have to alkalize your urine. Okay, and if you want to remove basic drug from your body, you have to acidify the urine. Okay, so we are seeing what is meant by urinary alkalizer. What are the example of urinary acidifiers? So acetylsalicylic acid, aspirin, and their derivative are nothing but the weak acids. So if you want to remove these as salicylates from your body, you have to make urine alkalized. Okay, alkali. Okay. So you have to use urine alkalizer to enhance the excretion of this salicylic acid from body. Now, if in case of overdose of salicylic acid, so you can use sodium bicarbonate to alkalize the urine. So once urinary pH is at a basic side, then it will be the being a weak acid. This will be easily ionized in the basic pH and it will be easily excreted. Okay? So that's all. So overdose of salicylate can be countered by increasing the excretion of this salicylic with alkalization of urine containing bicarbonate along with the potassium and sodium. So this is termed as a stage of compensatory respiratory process. GIT के ऊपर क्या एक्शन है इसका? Dyspepsia means less formation of gastric acid and pepsin extra. Nausea, vomiting as a result of gastric irritation. They will irritate your GIT, produce nausea and vomiting. Nausea मतलब मरना होना, vomiting मतलब आपको मालूम. They can they can produce peptic ulceration and GIT bleeding due to their chemical nature as a weak acid, and they are also COX inhibitor. So local inhibition of COX in the GIT, that is also responsible for the bleeding. So whatever bleeding or whatever bleeding is caused by salicylate due to they because they are nothing but the inhibitor of COX. Okay, they causes bleeding. So there is also one of the symptoms for this salicylic acid poisoning, salicylic acid overdose. उसका overdose या intoxication होने के बाद आपको एक symptom मिलेगा, that is bleeding, gastric bleeding. That is because of the inhibition of COX, local COX inhibition. Then again, this aspirin has a different actions. Aspirin or salicylic acid has a different actions. So they act as an anti-inflammatory and anti-rheumatic effect. So what is the anti-inflammatory and anti-rheumatic effect? So they are nothing but they will reduce the inflammation in the tissue and in the rheumatoid arthritis. That is because of the three reasons. So first reason is nothing but the inhibition of prostaglandin synthesis in the peripheral tissues. Then reduction of capillary permeability. They will reduce the capillary permeability and prevent the swelling. Then again, the inhibition of neutrophils aggregation and activation. So they will act as a anti-rheumatic and anti-inflammatory. Now, what is the action of salicylate on blood and platelets? Platelets के ऊपर क्या action है? Remember this point. Aspirin inhibits the platelet aggregation irreversibly because it is an irreversible inhibitor of cyclooxygenase, and this cyclooxygenase is also present in the platelet. So in the platelet, it will synthesize the prostaglandin. That prostaglandin are involved in the aggregation of platelets. Okay. Now, because of the inhibition of COX-1, there will be no production of prostaglandin, and there will be no aggregation of this platelet. That's why this salicylic acid or aspirin in a dose of 75 to 150 milligram. Remember the dose 75 to 150 milligram. This dose is, remember, 75 to 150 milligram dose daily. Daily administration of 75 to 150 milligram aspirin will prevent you from the developing heart attack. Okay, so that's why this aspirin is sometimes it is used as a prophylactic agent for different heart elements. So अगर आपका हार्ट का कोई बाईपास सर्जरी हुआ तो आपको ये एस्पिरिन की टैबलेट चालू करनी है, या फिर आपको हार्ट अटैक आ गया उसमें भी एस्पिरिन काम आता है. It is also prophylactic in nature. So to prevent the heart attack, so this is prescribed. Remember, it is an irreversible inhibitor of COX. It causes the acetylation of the cyclooxygenase. This daily dose of 75 to 150 milligram of aspirin will almost completely suppress the synthesis of your prostaglandin for 7 to 10 days. Okay, and that is responsible for the platelet aggregation. So they will act as a they will inhibit the platelet aggregation by inhibiting the COX in the platelet. Non-acetylated salicylate, for example, sodium salicylate. Non-acetylated salicylate, for example, sodium salicylate. It will not have such kind of action. Sodium salicylate will not have this antiplatelet action, but only acetylated derivative like aspirin. Aspirin is nothing but the acetyl salicylic acid. Okay. Sodium salicylate or methyl salicylate, they will not have antiplatelet action. Only acetyl salicylic acid, that is aspirin, will have antiplatelet. Remember this. Now, actions of aspirin on the liver and kidney. So they increase the secretion of bile. They increases the production of bile, stimulate the hepatic parenchyma to produce more bile. So this action is known as a choleratic action. Sorry, choleratic action. Cholestatic means they will suppress the formation of bile. So there are two actions which can increase the production of bile, that is known as a choleratic. Okay, this aspirin is a choleratic in nature. Then uricosuric effect. Uricosuric effect. In small doses aspirin, if you take 1 to 2 gram aspirin daily, salicylate interfere with the uric acid secretion. Okay, they compete with the uric acid for the excretion, and instead of excreting uric acid, they are excreted. Means kidney aspirin को excrete करेगा, uric acid को नहीं करेगा. So that's why raise in the uric acid level. So in smaller doses, they increase the uric acid level of your blood, and in the higher doses, if you take 5 gram per day, so they inhibit the reabsorption of urate from PCT, that causes uricosuric. So aspirin is a uricosuric drug in a higher doses, not in a smaller dose. So uricosuric dose कितना है 5 gram per day. Uricosuric means that will increase the uric acid secretion, that will increase the uric acid excretion in the urine. Why it is important? See, uric acid, if you got increase the uric acid in the blood, so that is nothing but that may develop you as a gout. So gout में क्या होता है? Gout में तो यूरिक एसिड लेवल आपका बढ़ जाता है, एंड दैट यूरिक एसिड combines with the different cations in the body like sodium, calcium and all that complex, that salt of uric acid with the cations that get deposited into your joints, and that is responsible for the pain, inflammation and swelling of joint. That is nothing but the gouty arthritis. So that's why this aspirin is also useful in the gout. In a higher doses it acts as a glucosuric drug, means it will increase the excretion of uric acid, that is helpful in the gout. Okay? Now absorption, distribution, metabolism and elimination of these salicylates. Salicylates are absorbed from the stomach. As they are very weak acid, they are completely absorbed from the stomach and upper part of your intestine. Around 80% of salicylate and 50% of aspirin bound to plasma protein, mainly albumin. Albumin को bind करता है ये plasma protein को. Dose dependent kinetics like phenytoin. That means in smaller doses they will follow first order kinetics, in large doses they will follow zero order kinetics. They will follow dose dependent kinetics or mixed order kinetics. Then there is another drug known as a diflunisal. Diflunisal, it is a non-acylated difluorinated salicylic acid derivative, has a higher analgesic action and anti. Then there is a one drug known as a benarilate. So that is a combination of your paracetamol and your aspirin. Benarilate. बाद में देखेंगे अपन. These are the actions of your acetylsalicylic acid and their derivative on different body systems. Now we'll see next point is nothing but the adverse reactions of your aspirin. Again, this is important. There was a question in GPAT 20 regarding the adverse effect of the first adverse reaction, intolerance. So your body will not tolerate this. Body of few patient will not tolerate the acetylsalicylic. So intolerance reactions are common like skin rashes. स्किन के ऊपर रैश आएगा आपको, यूट्रिक एरिया, देन प्रोराइटिस, एंजियोन्यूरोटिक एडिमा, ब्रोंकोस्पाज्म एंड एनाफाइलेक्टिक लाइक रिएक्शन और शॉक और थ्रोम्बोसाइटोपेनिया और पुरिया. So these are the intolerance reactions. Then anaphylactic reactions that may occur in the patient who are deficient in the enzyme known as a glucose 6 phosphate dehydrogenase. अगर कोई पेशेंट में glucose 6 phosphate dehydrogenase का deficiency है तो उसमें salicylate एनाफाइलेक्टिक रिएक्शन दे सकती है, पर्टिकुलरली इन निग्रोज में क्या होता है, ग्लूकोज 6 फॉस्फेट डिहाइड्रोजनेज का डेफिशिएंसी होता है. व्हाट इज द एडवर्स रिएक्शन ऑफ दिस सैलिसिलेट ऑन जीआईटी? तो डिस्पेप्सिया, नॉसिया, वोमिटिंग, हार्टबर्न इज ड्यू टू excessive secretion of gastric acid, ulceration. These are the common side effect of NSAID. So these effect जैसे डिस्पेप्सिया, नॉसिया, वोमिटिंग, हार्टबर्न, ये सब में ही मिलेगा आपको, बिकॉज each and every NSAID will irritate your stomach, that will cause hyperacidity. And chronic administration of this salicylate can cause gastric bleeding due to irreversible inhibition of COX in the lumen of GIT. So next is nothing but what is the adverse effect of aspirin and salicylate on the hematopoietic system, blood formation system होता है, उसके ऊपर क्या action है? So it can decrease the prothrombin level. So prothrombin level is decreased by salicylate by interfering with the actions of vitamin K in the liver. So you know that vitamin, we have seen already, this vitamin K is important for the synthesis of blood clotting factor like prothrombin and other. So you have, there are 4 different type of clotting factor which are dependent on vitamin K. These are synthesized in the liver, but this acetylsalicylic acid can decrease the prothrombin level of your body by interfering the action of vitamin K in the liver. Remember this. Next is a very important adverse effect of aspirin, that is known as a Ray's syndrome. This was question in G. So it is actually serious and fatal complication that occurs after few days after viral infection. इसमें क्या होता है देखो, जो children होते हैं below less than 12 years, aspirin is contraindicated in the children less than 12 years because of this Ray's syndrome. तो अगर क्या होता है, नॉर्मली अपन जैसे फीवर आता है अपने को, जैसे कोरोना का इन्फेक्शन में भी फीवर आता है, कोरोना के इन्फेक्शन में किसी ने नहीं बोला है आपको आप एस्पिरिन का टैबलेट लें, एस्पिरिन का टैबलेट नहीं लें. आफ्टर वायरल इन्फेक्शन, especially because of the influenza and varicella zoster virus, and if you have prescribed the salicylic acid to the children less than 12 years, there is a development of characteristic reactions on the body known as a Ray's syndrome. So serious and fatal complication occurs few days after viral infection, especially virus, if the virus is influenza virus or varicella virus in the children less than 12 years. That reactions are known as a Ray's syndrome. Particularly liver dysfunction is there. Liver dysfunction, chronic microsomal injury, consequent metabolic encephalopathy. These are the certain symptoms of that. तो उसमें पूरा आपका बदन पे थोड़ा सा ऐसे पिंपल्स टाइप का रिएक्शन आ जाएगा. तो redness, discoloration of skin, pruritus, etc. etc. These are the symptoms of Rett syndrome. That's why aspirin is contraindicated in the patient or infant and children under the 12. अगर वायरल इन्फेक्शन की वजह से आपको फीवर आ रहा है तो एस्पिरिन नहीं लेना है. This was question in GPAT. This syndrome is the adverse effect of your. Now we'll see the next drugs. Are you getting or not? समझ रहा है नहीं समझ रहा है मुझे बोलो. Now what is the adverse effect of aspirin and salicylate in the pregnant woman? So they may delay onset of labor and may cause greater blood loss during the delivery. So they may delay the onset of labor. Labor मतलब जैसे बच्चा डिलीवर होने का टाइमिंग जो है उसको डिले करेंगे ये. And they can cause greater blood loss during the delivery because they have inhibitory action on the prostaglandin. So that is the aspirin and indomethacin. They can cause premature closure of ductus arteriosus, result in the serious pulmonary hypertension in the newborn. So they are contraindicated. Premature closure of ductus arteriosus, the fetus in the neonate, result in the serious pulmonary hypertension. That is again adverse effect. Another is there is known as salicylism. So mild salicylic acid intoxication. Mild salicylic acid intoxication because of the high dose of salicylate develops in the salicylate level if the salicylate level of the body exceeds 25 मिलीग्राम. ये बॉडी में अगर 25 मिलीग्राम पर लीटर ये एस्पिरिन अगर गया उससे ज़्यादा गया तो ये सैलिसिलिज्म आपको डेवलप होता है. इज एडवर्स इफेक्ट ऑफ योर सेलेक्ट रिजल्ट इन द हेडेक डिजीनेस tinnitus vertigo then hearing loss of hearing problem in the hearing and diminution of vision drowsiness. so headache मतलब आपको पता है dizziness मतलब headache का टाइप है vertigo मतलब चक्कर आना tinnitus मतलब आपके कान में रिंगिंग होना difficulty in the hearing and diminution of vision drowsiness lethargy mental confusion nausea vomiting diarrhea that can occur. These are nothing but the symptoms of salicylism. So salicylism is also adverse effect of your salicylic acid derivative or aspirin. Then acute in salicylate poisoning होगा उसका या फिर overdose होगा salicylic acid का. क्या measures है? What are the different drugs used? Your characteristic feature of acute intoxication. Acute poisoning हो गया आपको salicylic acid का. उसके symptoms क्या है? Acid base and electrolyte disturbances. Then hyperglycemia, dehydration, hyperpyrexia, gastric irritation, hyperacidity, and hemorrhage or gastric bleeding. These are the acute intoxication. Now, what measures you have to take to counteract these symptoms? मतलब टॉक्सिटी कम करने के लिए क्या कर सकते हो? गैस्ट्रिक लेवेज मीन्स आपका पूरा जो है वो साफ करना. इरिगेटिंग सॉल्यूशंस. गैस्ट्रिक लेवेज, correction of hyperthermia, dehydration. Correction of dehydration means you can give different type of salines like ringer. Then you can increase the elimination of this salicylate by use of urinary alkalizer. Then peritoneal dialysis, vitamin K and blood transfusion also useful. These are the measures. These are the measures to be taken during the acute salicylate intoxication. Now we'll see the next drugs category. Next one is a therapeutic uses of your salicylic acid. Use क्या है इसका? कहाँ पे use? तो locally they are used as a keratolytic, fungistatic, mild antiseptic, counter-reactive. Okay? They have analgesic, antipyretic effect. That's why they are used in the arthralgia. Arthralgia means myalgia. Myalgia means muscle pain. Neuralgia means nerve pain. Headache, backache, dysmenorrhea. These are the uses. Due to anti-inflammatory activity, they are also used in the arthritis, rheumatoid arthritis, फाइब्रोमाइकोसाइटिस. आर्थराइटिस में यूज करते हैं इसको. रोमेटिज्म में यूज करते हैं. रोमेटॉइड आर्थराइटिस में. गाउट में भी यूज करते हैं ड्यू टू इट्स यूरिकोसोलिक इफेक्ट एंड एंटी इंफ्लेमेटरी इफेक्ट. कॉम्बिनेशन ऑफ दीज टू इफेक्ट्स आर यूजफुल. ओके. एंटी इंफ्लेमेटरी, एंटी रोमेटिक इफेक्ट. एंटी रोमेटिक होगा यहाँ. पेन इन्फ्लेमेशन टू रिलीव द पेन इन्फ्लेमेशन इन द rheumatic fever, so reduces the joint swelling. Then it is also useful as an antiplatelet agent to prevent the formation of platelet aggregation in the patient with ischemic heart. So it is a prophylactic drug used to prevent the myocardial infarction. Remember, prophylactic drug used to prevent the myocardial. Now, what is the miscellaneous use? It is also used in the treatment of Batter syndrome. याद रखो ये. Also useful in the niacin induced flushing. Niacin का जो deficiency है होता है उसमें redness and hot flushes would give that symptoms. These are the uses of salicylic acid derivative and their related drugs. Now we'll see the next drug, paracetamol. Next one is known as a